Hey everyone, this is Kaitlin Ryan, Doctor of Physical Therapy with PhysioEd.com. Thank you very much for joining us for our Q&A webcast where we are answering questions directly from our community. Please know that you can submit your own questions. Just go to PhysioEd.com, connect for free, and then you could be submitting your questions and we could be answering here directly. Just as a reminder though, these sessions are just general education about movement strategies, maybe something that someone is having difficulty with. So it's very general and broad. These are not intended for individual diagnoses. These aren't intended for providing a specific treatment for someone. We're just hoping that we can answer some general questions for you guys. So if there is something more specific that I am not addressing, please seek out your local physical therapist and maybe they can be able to help you out further. So we'll just jump right in and get started. We've got a question from David, who is 58 years old. He said that he had a knee surgery a few years ago, and while he is mostly doing fine, going up and down stairs still feels pretty tough for him. So he is curious if there are any strengthening exercises that he can be doing to trust his knees. So when it comes to going up and down stairs, we rely on our knees a lot. So I don't know exactly what kind of surgery David had. So I can't be super specific. I'm not sure if there is, a specific weakness in a muscle group for him, if it's pain or balance that's tough. So we're just going to be focusing on his request of strengthening exercises. And we're going to talk about 3 muscle groups around the knee joint that really help to support it. Now, an excellent article that you can find at PhysioEd.com is best knee exercises for seniors. So this is an article that will talk about some pretty basic and general exercises that are intended to strengthen your knee extension muscles, so your front thigh muscles, mainly your quadriceps. You also have the back thigh muscles, your knee flexors. Those are pretty much your hamstrings. And then you also have your calf muscles. So it may not seem like a big deal, but going up and down steps, usually you're putting maybe just the ball of your foot on that step, and you rely heavily on your calf muscles for strengthening. So although people can be very focused on their quad strength, don't forget the other 2 extremely important muscle groups that really help us with our knee strengthening and things like going up and down stairs. So an excellent exercise to be doing. Now, I should kind of backtrack a little bit. For any of these exercises, if they are causing pain, that is not what we are looking for. So if anything that I give you today to try out does not work for you, that's the recommendation to try out your local physical therapist, where they might be able to fine tune your program a little bit better for you. So when it comes to going up and down those stairs, the first muscle group we'll talk about are those quadricep muscles. So something simple like doing a standing leg straightening exercises or lying down supine on your back on the floor, on your bed, doing an active straight leg raise. Those are a couple of easy exercises to get started with your quadriceps. They're also helping a little bit with that knee straightening, that knee extension that is important when you're going up and down stairs as well. Another couple of easy exercises to try out would be for your hamstrings. So something like a standing hamstring curl, where you're just standing, holding on to a nice supportive surface and bending your knee, really focusing on almost kind of kicking your butt. Now that's a great hamstring strengthening. I don't think we get really a lot of good hamstring strengthening in our daily activities. So this one is typically, you can cause a little Charlie horse, a little bit of cramping. So just be aware of that. If maybe that hamstring is a little weaker, it might cause some of that. You could do just a gentle hamstring stretch where you're kind of bending down with your knee straight. So we'll put in the comment section, we'll put a link to this best knee exercises for seniors. And this is going to have some of these exercises in there. And then check out some other exercises at PhysioEd.com. So we talked about that quadricep, that straight leg raise. That's a very easy, gentle one to start with. There's also the hamstring curl. So something that's a little bit more of a challenge, if those are too easy for you, could be a squat. So a squat where you want to make sure you have your chest up, really relying on your quadriceps and your glutes. This really activates a lot of our muscles that are important for daily life and especially going up and down stairs. You could start off with a little mini squat just to make sure that you're not having any knee pains or problems. And then you could kind of work your way into a full squat to help with strengthening up those muscles. Those are also going to be important for your hip extensors, which are important for going upstairs. So your butt muscles. So those are really good ones to be working on as well. Now, in addition to these ones that are really focused on your thigh muscles, something like a calf raise or a heel raise is important to do to help build your calf strength. Some people have weaknesses in their calves and it seems like, oh, my knee strength or my quad strength isn't very good, when really it's the calf strength that's the problem, because that one is very supportive for our ankle and for our knees. And if we don't have a strong calf, it's impossible for our knee to be in a good and safe position. So something very simple like a calf raise is excellent to be doing. You can do this on both feet at the same time. And if that's easy for you, then you could try that on a single leg. So going up and down, lifting your heels up. You want to go nice and slow with all of these exercises. If you go too quickly, it can be very, so stairs, you need to have strengthening, not only for going up, but for also coming down. So we want to make sure we're strengthening our leg muscles as if we were going to be walking upstairs and downstairs. Now, part of that is called eccentric strengthening, where you are lengthening your muscles as you're working them. So when you are doing a calf raise and you go up onto your toes and your heels are off the floor, that is working those muscles as if you're going to be going up. And then when you bring those heels back down, it's almost like you're working those muscles when you were to be coming downstairs. So you want to make sure that when you're doing all of these exercises, you're going nice and slow, both up and down. These are working your muscles in two different ways that are both equally important when it comes to our functional strength and our functional mobility. So just as a little bit of a recap for someone who is having a little bit of weakness, they feel like in their knees, some simple strengthening exercises to build against all three muscle groups that are going to help support. You've got your calf muscles with those heel raises. You have your hamstring curls to work the back of your thigh muscles for bending your knees. And then you have some straight leg raises and squats too that can be helpful for the quad, your front thigh muscles. So it can be dependent. Maybe you have a weakness in one area versus another, but all three of these exercises are intended to focus on the major muscle groups, helping to support those knees going directly up and down those stairs. So hopefully David found those helpful and give them a shot. Again, these are not supposed to be causing any pain. So if it is causing pain, I don't want you guys to be doing these exercises on your own. Try and seek out the local therapists. All right, so I'm going to answer a couple of more questions. They're totally unrelated to the knee strengthening for the stairs, so we'll just jump right in. We've got a question from Susan, who is 64. She says that she tries to walk every morning. Fantastic. Keep doing that, Susan. I work with a lot of older adults who are in their 90s who are super strong, and I ask them all the time what it is that they do, and they say they walk. So I highly encourage you to keep up with walking every day. I think it's fantastic. However, she's feeling like her hips are a little stiff when she's getting going. So she's wondering if there are any warm-up exercises she can do to kind of loosen things up. I'm a big proponent of stretching and warming up before you're going to do exercises and activities. I was playing soccer with my husband and he strained his hamstring because he didn't do a warm up. He just tried to play soccer right away. I was safe and I did all of my exercises and stretching and warm up. So I highly encourage people to do warm ups, even if it's something for as simple as a walk. It really just helps to get things mobilized and moving, gets the blood flowing, loosens up your joints a little bit, and can just be a lot healthier and safer. So I highly recommend doing some stretches, and maybe you do a little bit of like a walk or lap or two in your driveway, and then you can do a little bit of a warm up with some of these stretches. So a really easy article that you can check out also on Physio Ed is the best exercise warm up for seniors. This is just something real short, real simple you can do. So maybe you're doing a lap or two in your driveway, and then you could do something really simple like a march, really focusing on bringing your knees up. If you have good balance, you can always give a little extra tug with your hands holding onto your legs and kind of hugging that knee to your chest. If you don't have good balance, then I would just stick with having your knees moving up and down in a march. That really helps to increase that flexibility for your muscle groups that you wouldn't get with just a normal walking pattern. And it helps you with warming up everything there. In addition to that, maybe a little bit of a side step or a little bit of a lunge. So that is going to help open up your front hips. It's going to help with opening and strengthening up your outer hip muscles as well, called your hip abductors when you do that side step. So I highly encourage you to go and check out that article. It does have some exercises with videos on there. We'll also put the link to that article in our comment section for this video. Now, in addition to these leg and these hip ones, there's also some stuff for your upper extremity, which I do encourage people to be doing. You're using your whole body when you're walking, including your arms. So this is just a great way to get some things flowing and get warmed up before you go for your walk. So check out that article. All right, and then our next and final question comes from Janet. She is 60 years old. She says that she sits at a desk for long hours, and by the afternoon, her shoulders and neck feels tight. She's wondering if there are a couple easy movements she can do right at her desk to release that tension. And I love this question. I myself am working on my flexibility for the muscles around my neck. So I'm going to give 2 easy exercises. Now, these exercises are not intended for anyone with a cervical fusion. This is just maybe you've got some muscle tightness going on just from sitting at a desk. So a couple easy ones. I'll do them right here. I'll be stretching kind of the left side of my neck here. So I'm just keeping my shoulder down. And I am just going to tilt my head. I'm trying to touch my ear to my shoulder here. This is just stretching the muscles through our upper trapezius. And this is one that can get really tight. Mine is very tight. I am working on this. So I love this exercise. I can do this throughout my day. Maybe I'm holding 20 or 30 seconds. And then I would just switch sides and I would do the opposite side. Now, it's important to keep your shoulder down because these muscles attach into our shoulder blade. And so if we lift up our shoulder, we're really not going to stretch no matter how much we tilt our neck. So keep that shoulder down, puts a lot of tension on these muscles, and then tilting your head, ear to the shoulder. Now, another muscle that can get very tight with a lot of sitting at the desk is one called our levator. So we're going to adjust our stretch just a little bit here. When we do this stretch, I always tell people you're going to try and smell your armpit. So you're trying to smell the armpit for this side. And you can give yourself a little bit of an extra tug, again, keeping this shoulder down, almost trying to get your nose and your armpit, and again, can come just a little bit extra. So this is just stretching muscles in a little bit further back than the previous one we were doing. Again, holding for about 20 to 30 seconds. It's pretty much all you need. Maybe you're doing it a couple times, but you can do these exercises throughout the day. Again, to stretch the other side, keep that shoulder down, nose into your armpits, and you can just give a little extra tug as you feel is comfortable. Now, you don't need to hurt yourself with these stretches. I always say we want to have the discomfort of a stretch, but we don't want to be so painful that we're causing more harm than we are good. So please be cautious. Don't overstretch yourself at all with these. So these are the 3 questions that we are going to be answering today. Please check out Physio Ed Connect. It is free. You guys can submit other questions that you may have so we can answer them here. We are having questions coming in, so thank you guys very much for submitting those, and we'll keep going through these on a weekly basis, answering these questions that are popping up with these webcasts. Again, check out Physio Ed Connect to submit those questions. We also have some things going on for downloading like a fall risk checklist. And there's also a 12-week bone strengthening program. Now, this one goes on a week-by-week basis to help out with building our bone strength and helping to prevent falls, which I know is a big concern for a lot of us. So thank you guys very much for joining us today. Stay healthy and active for a lifetime here at Physio Ed. Thank you.